Okay, this process of regulating blood pressure with aldosterone is pretty crazy. It's one of these weirdo kind of system built on a system built on a system. And a lot of students find it a little confusing. So I'm going to try and break it down, make this as simple as possible, where we talk about these different hormones. So let's go to handout 21D. And I am going to start this at the bottom. So I'm going to move this all around and talk about what's going on here. Now, I'm going to start here in the bottom left corner. I'm going to zoom in here so that we can explain some things. Okay, so what we have here is three scenarios. One of them pertains to our chapter directly. The other two are just kind of extras, but they're related as well. Well, one of them's kind of related. The other one's really not. So we have three things that may be going on in our body. We have low blood pressure. We might have low sodium levels, or we might have high blood potassium levels. So if you have low blood pressure, for some reason you have low sodium, or if you have a bunch of potassium in your blood, maybe you ate a bunch of bananas, this aldosterone's got to kick in and signal a response to this. Now, this is going to be sensed in our kidneys. So let's just use low blood pressure as our example here to begin with, because that's what our chapter is about. So the body has low blood pressure. The low blood pressure is going to be signaled by the kidneys. The kidneys recognize this low blood pressure. And so what the kidneys are going to do is to respond to this low blood pressure, they're going to release a hormone called renin. And it's dumped into the bloodstream. So renin, secreted by the kidneys, renal, kidneys, renin, renal. The renin is going to be dumped into the bloodstream. Now, in the bloodstream, what renin does is it activates this protein that's made in the liver called angiotensinogen. And angiotensinogen is going to react with renin and become activated into angiotensin 1. So renin converts angiotensinogen into angiotensin 1. Remember our OGEN rule, OGEN? This is the inactive form. If you cover up the OGEN, it tells you what it's activating, angiotensin. So angiotensinogen is activated into angiotensin 1. Now, this is all in the bloodstream, right? So the bloodstream, we are having angiotensin 1 traveling around in the bloodstream. Now, there is a enzyme that is made in our lungs called angiotensin converting enzyme. An angiotensin converting enzyme is an enzyme that has to convert angiotensin 1 into angiotensin 2. Now, this is happening in the bloodstream. It's not happening in the lungs. My picture kind of gives you the impression that this is going on in the lungs. It's not. It's just that this angiotensin converting enzyme is made in the lungs. Then it's dumped into the bloodstream. And what it does is it converts angiotensin 1 into angiotensin 2. Now, angiotensin 2 is floating around in our bloodstream, and it's going to come in contact with aldosterone that was made through the process of our other handout, handout 21C. So we've got adrenocorticotropic hormone telling the adrenal glands to make aldosterone. That is what's going on right here. So our adrenal glands are secreting aldosterone. Aldosterone is already in our bloodstream. It comes in contact with angiotensin 2, and angiotensin 2 activates the aldosterone. Now, after the aldosterone is activated, it is going to be telling our kidneys to regulate these three processes. So in the case of our low blood pressure, what aldosterone is going to do is it's going to tell the kidneys to retain water and not dump it into the urine. And that is going to raise our blood volume. When we raise our blood volume, we raise our blood pressure. Now, this same process is going to happen if we have low sodium. So if we have low sodium, aldosterone is going to tell the kidneys to not dump sodium chloride into our urine. So it's going to keep that sodium in our body, and it's going to raise and retain the sodium levels. This also helps raise our blood volume. And then something that's not really related to our topic of blood pressure, but if we have a high blood potassium level, ultimately this aldosterone is going to tell the kidneys to dump excess potassium and put it into the urine so that we can excrete it out as a waste product. We don't want a lot of potassium in our body. It can cause all kinds of bad problems. You can go into comas, and it messes with your action potentials. So we got to dump that potassium. And this is how it's done with the what we call the renin-angiotensin-aldosterone reflex. So I'm going to raise this up just so you can kind of see the whole thing. And this process is, it's a Rube Goldberg process. It's a system built on a system built on a system. But it involves these 4 hormones: renin, angiotensin 1, angiotensin 2, and aldosterone. So make sure that you know this handout. It will certainly be on our exam. And it's a way for me to introduce to you 4 new hormones. Make sure that you know all 3 processes, not just the blood volume, but be able to give me an example with potassium as well. Okay, so this should take care of chapter 21. Remember, our test, it will be coming up, and you need to be going over this stuff. The test will be on D2L, and you will see a date for that pop up here when I get the test started. So I will see you for the next chapter. After this chapter 19 and 21 test, we will go into chapter 12, which is one of my favorite chapters, one of my favorite topics, the nervous system. So we'll go into chapters 12, 13, 14, and 17 to end the semester. And I'll see you in the next video.